We're going to be talking tonight a lot about the Thriving Pet Expo, but we're also going to be opening up this for questions, so you guys can ask any questions that you want. But I want to introduce you to somebody we don't see very often on social media, so not everybody knows, but you are in for a treat tonight. So, and we're just so excited because Dr. Kangas is starting to really come into this space. And so Dr. Katie Kangas is here with us tonight. Dr. Kangas, welcome.
Thank you, Carrie. It's my pleasure to be here, and super duper pleasure that I get to present and join the conference this year. So really looking forward to it.
It's exciting because, you know, we love and see some of the same faces all the time, and thank God they still push through and they continue to go and talk to us and educate us. But it's also very exciting to see new faces, and Dr. Kangas is coming into this space. So we're excited to have you come and talk to us and be at the Thriving Pet Expo. She was there last year, but was only doing the Q&A, but this year she's going to be doing the Q&A. She's going to be doing an amazing talk. So without further ado, we want to announce the topic. We've been kind of hush a little bit, but tell us a little bit about what you're going to be talking about.
Awesome. Thank you. This year I'm going to be speaking about dental health, which is so paramount to whole body health and holistic and integrative health. And I have a very big background in dentistry, and I've actually written and taught and presented on dental health from an integrative standpoint to not only, pet parents and writing articles and all kinds of venues, Dogs Naturally and Animal Wellness and things like that. But I've also presented to veterinary groups, to, colleagues, and have taught continuing education on dentistry to them too. So definitely a big background that I have, and a big passion that I have, because once I really got rooted in understanding veterinary dentistry, I also got a very solid background in understanding that dental health absolutely affects whole body health on so many levels, 24/7. So a really good way to be proactive for our pets and ourselves is to pay attention to dental health, because that's affecting every organ system in the body. And as we'll talk about in the presentation, it's affecting levels of inflammation. And inflammation is at the core of every chronic disease you can name that we don't want our pets to have or ourselves to have. And simply put, when there is dental disease, periodontal disease, that is driving inflammation everywhere else. So it's a great way in addressing dental health in reducing inflammation in the body, period.
It's such a topic that, we hear about it. It's talked about in so many, how many times did we hear like big dog food companies telling us to feed kibble because it cleans their teeth? So we've been hearing a lot about dental care, but yet it feels like it's just stuck, because I still see, we check every dog that comes into the spa, every single dog, we check their mouth. And it's not because we're trying to upsell anybody, but we want them to be aware. And so every single dog, we say, this is what's going on with your teeth, with your pet's teeth, and your dog needs to get into your veterinarian.
Awesome.
I will tell you that I mean, I'd have to guess. I haven't tracked it for sure by numbers, but I'm going to say it's 90%.
Of pets that have dental issues
that need to, I'm going to say it's 90%.
So you are spot on. And as people will learn in my presentation, dental issues is considered the number one disease problem in small animals, in pets. Ugh. So it is like above all, and we know everything, cancer's on the rise, inflammatory bowel disease, IBD, allergies. These things are so common now, but dental disease is literally like the number one thing, because like you said, 90% of pets have it, 90% of pets don't have, IBD, even though it's common. So dental issues are incredibly common, and that's all the more reason that we should be doing our best to support our pets proactively to not have these issues.
Yeah, it's just, it's rampant. And it's just, people think, I think the biggest problem, like people always ask me, should I brush my dog's teeth? The answer is, I always say yes. And they're like, well, I can't do it all the time unless my husband, it doesn't matter. You got to check their mouth. That's my big reason. Even if you can't get in there really well with the toothbrush, right? At least you're looking and you're seeing what's going on.
You're exactly right. Yep. Having, a visual in there on a regular basis really is invaluable. And anything that people can do, and definitely daily is the goal. But even if you can do it, as many times a week as you can, think of it and get that done, that
Right.
is very beneficial. And like you said, actually looking in the mouth and finding things early and being aware of what's going on in there is step one. So
Yeah, like when people think about dental, they think about teeth, right? That's the number one thing they think about. But it's really more when you, I mean, I'm thinking more of the gums, right? Like there's
yes.
growths and things that happen.
Exactly. Exactly. It's both. But, gingivitis is the first indicator of dental disease. So we're always looking at the gums. But like you said, there can be gingival hyperplasia, there can be gingival masses or tumors, oral tumors, broken teeth, fractured teeth, all kinds of stuff that you can find that, will help you to support your pet best.
Yeah. So I'm going to kind of start this off with some questions for you. This timing is coming out perfect. So I told you before we started this, my dog has a slab fracture. So one of my questions I have for you is I don't feed my dog bones anymore because he's had this slab fracture for a while, and we kind of been keeping an eye on it. And so in the last couple of months, we're noticing that it is becoming a problem. So, but I stopped feeding him bones a while ago. But my first question to you is, what do you think about bones for dogs?
So I actually have this in my presentation, but I will briefly, cover this in that raw bones, especially the raw meaty bones that are of appropriate size for that pet, should be safe as far as for the teeth and really for the intestinal tract too. Cooked bones are not safe because cooked bones, when you cook them and heat them, that turns the texture brittle, and then they can splinter when they're crunched on or bitten into, and then you can have sharp shards of bone that penetrate through the esophagus or the intestine, and you could get a perforation and bad news there. When it comes to dental health, broken teeth are a big issue, and it's estimated that at least 1 out of 10 dogs has a broken tooth in their mouth. Okay. And they're always an issue because not only are they painful, even though dogs do really well masking that pain, they will eat through broken teeth. And literally we'd be walking around going, oh, I need to get to a dentist like tomorrow,
Right.
and dogs will eat right through that. So we know it's painful, it's uncomfortable. Again, it's allowing inflammation to build there and infection, because once there's a fracture, if we're lucky, it might not go through to the root canal, but a lot of those are going through to the root canal. And then you have an open avenue for infection and abscess, and the root canal is leading to the bloodstream. So again, then you got bacteria entering the mouth, getting in that root canal and spreading to the pet's body, to the heart, to the kidneys, to the lungs, to everywhere. And so you not only have inflammation, but you have bacterial, overload and toxins being spread. So
Yeah. That's what we're worried about with him right now. He's old. He's an older dog. He's almost
yeah,
14. So I'm
yeah.
kind of in, his teeth
And
look great, but he's got that
yeah,
slap fracture. And
exactly.
now, yeah.
And
So now
slab
I'm starting
fractures
to
usually occur on this upper cheek tooth,
yep.
we call it, which is the upper fourth premolar. It's the big one up in the back of the mouth. That's a 3-rooted tooth. And if it is left untreated, sometimes could take months, maybe it could take longer, maybe a couple years down the line. But at some point, they usually will abscess. And then the dog will get a big swelling under their eye because the tooth roots are way up here. And that can get misdiagnosed. And fortunately, most veterinarians are pretty on top of that now. But years ago, I've been a veterinarian for 30 years. Years ago, that would get misdiagnosed all the time as a bee sting or a bug bite. And they would get, Benadryl or steroids or whatever and send them home. And it was literally a tooth root abscess, which, by the way, is excruciating. I mean, that
Yeah.
is really, really painful.
Yeah.
So,
Yeah. We're working on it because I am going to have it pulled.
yeah.
But we got some, I told you before, a little misdiagnosis. So they set me back because now they wanted me to go to a cardiologist, and it turns
Yeah.
out.
Yeah. So it's good to know that the sooner the better,
Yeah.
And
No, we're gonna,
I mean, a lot of times dogs are hanging out with broken teeth all the time and people just don't even know it.
oh yeah.
But, if we know about it, we want to do our best to, take care of it sooner than.
Yeah.
Sooner
I'm just kind of back and forth whether like the bone thing, because I think that's what happened because I used to let him chew on bones, and now I'm like,
Right.
I don't think I'm gonna.
Right. So what I cover this too, but the veterinary dentist, because I've worked alongside of veterinary dental specialists, so that's one of the reasons why I have such a big knowledgeable background in veterinary dentistry, is that If it's hard enough, if the chew object is hard enough where you can't bend it with your own hands or dent it with a fingernail, it is hard enough to break a tooth. Now, however, if you have a large, bulky, like a knuckle bone or a marrow bone that's really big, kind of compared to the dog's mouth, it is less likely, even if it's hard, it's less likely that they will break a tooth, just statistically less likely. Whereas if it's long and thin, like a nylon bone or an antler or a hoof, those are like bad news. Um, then the force that their jaw, when they're chewing on it, there's so much space in there. When their jaw comes down to chew on it, they have more force that can break a tooth. If it's taken up kind of their whole mouth and they're just kind of gnawing on it, usually it's not going to have enough force behind it to really
Yeah.
come down and break that tooth. But that's just statistical likelihood going there.
I don't study bones, but I talked to a wolf expert one time and he said that the rib bone is the softest of the bones. So I was like, maybe.
And that makes sense. And I wouldn't have known that inherently, but that,
Yeah, I didn't
makes
either.
sense.
And he
Sense.
apparently
Yep.
is out there seeing a lot of kills and says that. But
Right.
so I want to tell you a couple things that people are saying. So because I think it's important and that you hear this. So let me see. I lost it. Where is it? Did I lose? Oh, Dr. Katie was literally one of the first doctors I learned from on a dog summit. She was excellent, and I learned so much from her.
Oh, thank you.
I
Thank
know
you.
that's from Janelle. That's from Janelle. And then Lauren wants to know, is a fracture different from a chip? If a dog chips their tooth and shows no signs of discomfort, what should we look for as concern?
Yeah, super good question. So that's kind of nomenclature. A chip and a fracture technically are kind of the same thing, but a chip would sort of imply that it's a tiny amount and maybe at the very tip. And if it's at the very tip of the tooth, likely and hopefully it's just the enamel that's been, removed or damaged. But the layer right under the enamel is called the dentin. That's the middle layer. So if the dentin is exposed, the tooth can still be sensitive because there are nerve endings in the dentin. The good news is that the enamel is inorganic. It's got no nerve endings, got no feeling. So, if it's just a chip in the enamel, it's not a big deal other than the fact that it's exposing the dentin. But if that chip is a larger chip, then depending on which tooth it is, you could be in the root canal pretty quickly. So that would, the chip thing kind of depends. But in many cases, there can be a little chip gone. That's not a big deal. If just the dentin is exposed, then they can just put a bonded sealant on it and just seal over so it protects that dentin from being sensitive. So every time cold or hot or wind or air, because dogs pant, every time it hits the dentin can get sensitive from that. We know, like, if our enamel gets worn away, your teeth can be sensitive. That's that dentin layer. So yeah, so it's nice to curb that sensitivity for them and put a little bonded sealant on it. But maybe not all chip teeth need that, but a lot of them would. So yeah.
How
So
is it? How far are we? I have a dental specialist here in Tustin called Dr. Van Nice. I don't know if you've heard of him before,
Mhm.
but are we starting to see more dental specialists?
Absolutely, because we're starting to see more specialists of all kinds.
That's
And the
awesome.
reason for that really is that medicine and medical knowledge and technology is advancing so rapidly that we know so much more now. And to be an expert, to really give detailed care in that niche of medicine, it's really hard to do all that as a general practitioner. And to be frank, most veterinary general practice vets don't have a good level of dental knowledge, and it's hopefully getting better, but I think it's still true that there are many veterinary schools that don't even have veterinary dental specialists teaching on staff. And in a 4-year curriculum of veterinary school, we get a very small piece of dental education in that time. And I always tell people, your dentist, your DDS, has completely different credentials in schooling than your doctor who's an MD. I mean, a DDS, all of their medical schools all about the mouth. And we have like an itty bitty bit in 4 years. So that is the reason for specialty, is that when you get above something that's really basic in the mouth, it's really good to go to a specialist. You'll
Yeah,
get
I
better care.
think I'm going to be taking him over to Dr. Van Nice. It just feels right to do that.
Yeah,
But I'm just wondering, like, I know I have access, but I'm just wondering, like, is this something that people are going to have access to? And the importance of it? It seems
right.
like for such an important part of the body's function that we should be seeing a specialist for it.
Yeah, if at all possible, that's what I recommend. Absolutely, they're getting better care. You're generally getting better educated about how to be proactive, and, dentists love to save teeth too. I mean, a general practitioner, oftentimes, just because they don't have the same skill level and the same equipment and the same training, it's like, well, your only option is extraction, whereas a dental specialist might be able to help save the tooth.
Oh,
So
that's
it
so
depends,
important.
what's going on. So
What do you think the risks are of when teeth? Because I mean, people. I have clients that go in and they go in for one tooth, and before you know it, they pulled the whole mouth. What are the risks, do you think, involved in just pulling teeth like that?
yeah, well, great question, because there's a lot of levels of what we could talk about in that,
Yeah.
in even in just that question, in that dental extractions are surgery. They are a big deal. And that's why when people are like, why is a dentistry so expensive? Because they used to be so cheap. And I hate to
Right.
say the reason they were so cheap is because a lot of times veterinarians weren't doing a great job.
Ugh.
And it is surgery. I mean, you're going in there with drills and elevator, you're sectioning teeth to be able to get them out. And so the risk is a lot higher with a general practitioner vet who does not have expertise training in dentistry. But as soon as you go to a board certified dentist, your risk level is way lower because these people know what they're doing and this is
Yeah.
what they're highly, highly trained for. And they do it every day. That's all they do. That's all they do is the mouth. And so, that's why I like all of my patients to go to a dental specialist, because then the risk of something, a problematic thing happening, because what can be a risk is that they can damage the gums, they can leave root tips behind if they don't know what they're doing, and paid for an extraction and your pet still has pieces of root that are left in there that can fester and abscess. If it's a small, what I always tell my clients is, if you have a little bitty dog, a small breed dog that has and they often have significant dental disease. I hate to say it, we're going to cover that, the prevalence
No.
of different breeds and genetics and all that kind of stuff. Small breed dogs often get a lot more advanced periodontal disease earlier in life. It's not uncommon for a 5-year-old Yorkie to have 15 teeth extracted already. And a 5-year-old Labrador would almost never have,
Right.
I mean, probably any extractions. And so little breed dogs, if they have significant dental disease, when the lower first molar, if that needs to be extracted, the amount of jawbone around that, once that tooth starts to get diseased, is really, really tiny. And if you don't have somebody really expertise to getting that tooth out, extracting that tooth, one of the risks, the jaw can break. The jaw can break during a dental procedure. Now, that said, the jaw
Right.
could break if they jump off the couch and, hit
Sure.
something, if there is a lot of disease in the mouth, because that bone is so weakened and the bone has been eroded away around that tooth root that's infected. So the jaw can break doing other things too. But talk about having instruments in there and trying to elevate this deep root out of there when you got a little bitty jawbone supporting it, and so that happens. And that's why I tell people, if you have a small breed dog especially, I highly recommend going to a dental specialist.
I'm
So
glad to hear that they're getting more of them out there, because
yes, more and
back in
more.
the day, I didn't know they had them 23, 25 years ago. I never even heard of a dental specialist.
Yeah.
So it's
Well,
great.
really, it wasn't until the 1980s that there was even that specialty was even around.
That's so
So, and
crazy.
it's growing rapidly, which is
Oh,
really great. Yeah.
yeah,
So
it is.
any major city, I mean, in a rural area, you may not find one, but it's pretty surprising how many areas. I have clients all over the country that have veterinary dentists. So I just talked to somebody today in Florida who took her dog,
That's
especially.
awesome. That's
Mm-hmm.
good.
Super awesome.
So Kayla has a question. She says, my dog has a tumor in his roof of his mouth, and at an annual exam done in May, she said when she told her at the exam for the tumor 3 months later, she said to me she never looked in his mouth. Trying a holistic approach to slow the tumor, regular DVM said nothing to be done. Spend as much time as you can with him. She mentions an antibiotic to try. Is it worth it, or will it just upset the gut immune system?
Yeah, great question, Kayla. Good for you. From what you're telling me, granted I can't see it, If it looks infected, then that's another story. But if it doesn't look infected, I would not use antibiotics because I don't expect that antibiotics are going to do anything for that. I think they're at a loss if they don't know what else to do. Maybe antibiotics will shrink it if there's some infection there, but more than likely it is a mass which could either be a benign tumor or it could be a more aggressive tumor. I will tell you that tumors or growths in the mouth have a higher ratio or higher likelihood, just sheer statistically, than like skin lumps. They have a higher likelihood to be something more aggressive. So even though there are a lot of benign things that can occur in the mouth, veterinarians that know dentist, that know oral health, and certainly veterinary dentists, if there is a growth in the mouth, they're like, just biopsy it, because they get fooled all the time where something that looks really quiet and benign will be something aggressive, and something that looks really yucky and people are like, oh my God, that's cancer. The pet probably has this terrible prognosis, and they'll biopsy it and they're like, it's totally benign. So you can get fooled both ways. So if Kayla, if you can find a veterinary dentist, I highly recommend to have your pet evaluated by them, just to at least hear what your options are, because they may give you some options. I mean, they will, because your primary vet probably doesn't have a lot of, expertise in that frame. And then at least you'll know your options. Regarding holistic stuff to do, of course, there's always things that can be done. I'm going to cover, several of the products that I really like to keep the mouth healthy in my presentation. But there are essential oils. If your pet will let you, you can rub some essential oil on that lump, and you can base that in coconut oil. And there are specific essential oil blends that are made for the mouth. And one that I would point you toward is Dr. Melissa Shelton, who's a veterinarian, who's an essential oil expert. Her essential oil line is called Animal EO or Animalio. EO stands for essential oils. And she has a formula called Dog Breath. And that has 4 different essential oils based in coconut oil. And you could put that right on there. The great thing about that oil is that blend is designed to address infection. So if it was infection, it's got antimicrobial action to it. It's got significant anti-inflammatory action, and some of those ingredients in there can actually shrink tumors too. So the other oil it's in there. Never mind, because that blend is peppermint, helichrysum, myrrh, and copaiba. And if you know anything about essential oils, myrrh is fantastic for tumors and for oral tissues. Helichrysum is a powerful healing oil to tissues. Copaiba is awesomely anti-inflammatory. It's been shown in studies to sometimes outperform prednisone. It's like that good of an anti-inflammatory. Oh. Peppermint is a good antimicrobial and happens to freshen the breath. So, great one for oral, mouth protectant. So
see why we love Dr. Kangas so much. She gets it's just amazing, because you get to the point well, and then you always have the best advice. Like, it's just like, okay, this is what my answer is, and this is some great advice. So unlike some politicians, they never even answer the question. I'm like, did you even get to the question? What the heck? So
and thank you for framing that. And that really, is rewarding for me to hear that I'm useful, that this is of value to people. And it's so nice to be holistic and integrative, especially as experienced as I am doing it, because I've been doing holistic or integrative really only for 15 years. I've been a vet for 30 years and really focused on or specialized in holistic for 15. So I've amassed enough information and enough experience that there's always something we can do to be proactive. And that's the beautiful thing, because oftentimes in, conventional or Western medicine mindset, there might be a few options to address something. And then beyond that, you're like, I'm out of options. And oftentimes they're not proactive. I mean, they're almost never proactive. They're reactive anyway. But in a holistic, approach, there's always so many things. There's so many categories of options and resources. So
I can't give it away, but I cannot wait for the Thriving Pet Expo. I don't want to give it away because I can't, but I just want what you just said right there is going to be key to what's happening at the Thriving Pet Expo, but I don't want to give it away because it's going to be a fun little thing we're doing. So I can't let the secrets out. You guys need to go.
Because
And it's funny because people think, oh, they just want to sell tickets. It's not really that. It's we want the more people that are in that room, the more energy is created. And the more
Yep.
energy that's created, the more force we are. And, it's like, it's creating this force for change. And we can't do
Yep.
it with 2 or 5 or 6 or 8 people. We need thousands, right?
Exactly,
We need
exactly. It's
thousands.
almost like on a collective consciousness level, that vibration does rise. The more people that are learning and interested and getting educated, it literally, it
Yeah,
does, it makes a difference. And it's almost like, because of course, I do all this and follow spiritual gurus and meditate and all that kind of stuff. And they say you get a lot of people in one room meditating, and it literally raises the consciousness
yeah,
level, just because of all of those energies combined,
yeah.
so
And that's why it's like it's trying to get people to understand that like we can do these talks and they're helpful, but we want to drive change. And it's not just for, it's not just driving change because I want my dog. If we don't drive the change, you're all going to find yourselves at that veterinarian hospital that's not giving you the answers. It's not driving it's changing veterinarians' perspective so
yeah,
that we all of us throughout the entire world can go to a vet and not have this friction and this battle, and ultimately we have these animals that aren't getting help. So these expos are really about that driving energy that is
yeah.
gonna is
And
gonna
empowering people to have that confidence and that
that's yeah,
knowledge and background, so that they can field those situations better with their vet and know when to get a second opinion, or when to how to reply to the veterinarian to really steer best the healthcare that's going to occur for their pet, to be the best advocate for their pet.
yeah,
And the other thing that I love what you said that I'll tag on to is that last year I came, sort of last minute, because Billy Hoekman couldn't make it, and I didn't have a talk quite prepared, but I so enjoyed being part of the Q&A, and just the feedback and the interaction from all of the attendees with all of us up there on the panel literally just fueled, and it sparks everybody's interest and passion, and sort of the value you get out of it with that direct interaction. It was really,
yeah.
really great. And everybody
It
felt
is.
it. Everybody loved it. Everybody loved the Q&A.
Yeah, the energy is, it's interesting because we hear a lot, when we get frustrated, and I get frustrated with conventional vets too. Before we started, I was talking about some frustration I have. And a lot of times when we're talking about our frustration, we hear back in some of our Facebook groups, vets are committing suicide and they have this huge suicide rate. And it's so true. And suicide has touched my family. Most people know my brother committed suicide. And that one of the reasons I think that vets are feeling that is because there is that disconnect and between the client and so this isn't just about making the vet do it our way. It's about helping them, because it's got to be frustrating for the veterinarians to. I know one of the reasons I left the vet world is because it was frustrating for me to watch these animals be sick all the time and no change, the same chronic ear infection over and over and over and over and over.
Yeah.
And
Yeah.
as a person who went into vet school, right, as you can say, right, you go through vet school because you want to heal animals, not because you want to just be stuck in the death and the pain and the suffering and the tears and the blame game and all the stuff that I know vets are facing. So bringing all of you guys together in this room isn't about going after the vet, it's about helping the vet. So for all of you that keep coming at us saying vets are killing themselves, stop beating them up. We're not beating them up. We're trying to help them. So, and this is what this is about. So I hope that's why I want so many people in that room, because then when they go back to their states or their counties or their cities or wherever it is, that we help the veterinarian, because the holistic vets, right? The holistics, like Katie, you must get a lot of reward out of the healing process, right?
I so do. And that's what, just what you said, just getting, feeling so limited in helping patients with the standard conventional construct of medicine. That's what, of course, as motivated and inspired anybody who does holistic and integrative is like, there's got to be a better way,
Yeah.
and that's what pushed us to go seek out the kind of training that, we now have. so that we can help our patients more outside that standard construct. And, the really good news is that, I mean, I think on a global level, I mean, because, a lot of the podcast, I mean, everything's, international on a lot of the, social media and all this stuff that we do. People are plugging into integrative and holistic and proactive and natural support of healing and health at levels like never before.
Right.
And so it is in demand, it's in high interest, and that is going to drive the market. I mean, vets are going to have to,
You have to.
you got to come to par with this, because this is what people want. And the more we educate pet parents on what to look for, what to ask for, that's going to fuel veterinarians to start doing more of it, because this is what their clients want and
Right.
their patients need ultimately. And believe me, vets are getting interested in it too. I mean, there's, younger generations of vets coming out are a lot more interested, but there's still a ways to go, but it's definitely it's expanding, and it's going to keep going. So
Good. I'm happy because it's, we have all these sick animals that I hate to say it's too late, but for sometimes it is, right? Like the animal's 14 and he's got all these problems, and
well,
do we
I
have
mean,
time?
yeah,
Do we have time?
that's a great question. Everything is, everybody's an individual, every situation is different, but it's rare that I mean, it can happen, but usually there's at least some time by the time I see patients to at least make a difference with their quality of life. We
Yeah.
may not get a time, but we often do. It just
Yeah.
depends on how soon. But I mean, I've seen pets come to me that are in the end stages of cancer, and sometimes you don't have much time, but you'd be surprised.
Yeah.
Sometimes people think there's no time, and these pets will go on for months beyond what we're expected, or they go another 8 weeks, and those 8 weeks were comfortable and joyful rather than miserable.
That's the most important part, right? But
Yep, absolutely.
generationally, I'm hoping, these younger vets that are coming in and being interested in this, that we can fix generationally, right? Like get these puppies to be healthier, and
Totally.
because
Yes.
this is just awful. It's
Yeah.
awful watching. It's so sad. So let's get to a couple of questions. I knew this question would come up. I'm glad that it did. So Lauren wants to know, are non-anesthesia cleanings worth it? We hear conflicting information about how effective they are. On the contrary, if dogs are healthy and diet is good, should there ever be a need for cleaning that requires anesthesia?
Such a great question. So again, a big topic. I've got slides on this and discussion on this in my presentation, but what I will say is my feelings, and by the way, if anybody follows Dr. Karen Becker, she is such a great, reliable resource. And by the way, her teachings and discussions on dentistry very much align with what mine are. And neither of us are a fan of non-anesthetic dentistry, but I will tell you why. In that the vast majority of the time that a pet is getting their teeth cleaned without anesthesia, that is usually giving them a cosmetic service, not a health value. And the reason for that is what is helping the pet's health or our health when we're getting our teeth cleaned is when the gums are cleaned at the level, at the gingival level, at the gum line, not on the crowns of the teeth. So if they're just scraping the tartar off the teeth, big deal. That's cosmetic. Tartar on the teeth, if it's on the actual enamel of the teeth, the body doesn't care about that. It's the tartar at the gum line. So they've got to be able to get it at the gum line. And importantly, it's got to be in those few millimeters of subgingival space, we call it. So that's like inserting a scaler up a few millimeters under the gum line and scraping down and then being able to polish that. Achieving that in an awake pet on all surfaces of the teeth, you got the outside. What about the lingual side? What's going on the tongue side and the roof of the mouth side? You got all that decay and everything going on over there. And how are you getting up in there with the scaler? And maybe a really good hygienist that's highly trained, or that was a hygienist in human dental care. But a lot of the people that are doing these non-anesthetic cleanings for pets have like a 1 weekend training seminar thing, and then they're doing this. So if you had a very tolerant pet, they didn't have a high level
Lost
of
you.
disease. Oh, you did?
lost you for a minute, but I think we're
Oh,
losing you a
that's
little
such a
bit.
bummer. Okay. I show that my
Okay,
signal
there
is
you are.
okay. Oh, what a
There you
bummer.
are.
Okay.
We got it.
So, okay, good. So I don't know how much you missed, but I was just going to say that if you have a very uh, expertise trained hygienist, you have a very tolerant dog, and you don't have a high level of disease and you literally just have minimal stuff going on, then maybe a non-anesthetic cleaning could be of value. You also have to make sure that the pet's not injured. Sometimes those sharp scalers, they'll cut the gingiva or the tongues have been cut and stuff like that. So you got risk involved too. But my main concern is that they're leaving disease in the mouth, and people see cleaner looking teeth and they get this false assumption that my pet's mouth is healthier when it's merely just looks better. So that is the big, issue. And then there was another piece of that question that was a great question also, is that if your pet's eating a good diet, that's already a huge factor in, supporting good dental health. And, if you're brushing the teeth or whatever, and should you ever even need a cleaning under anesthesia? Theoretically, no. And in some circumstances, that can pan out, especially if you have a large breed dog. But if you have a small breed dog or a brachiocephalic breed dog, pushed in face dog, teeth are all crowded, they're all, they're like wedging in all this plaque and food debris and stuff like that. Even if they eat a good diet and you're brushing, they can still get dental disease. And in fact, my client who I talked to today on telemedicine in Florida, who has a 10-year-old small breed dog, and she's like, I have brushed my dog's teeth every day since my dog was a puppy, and she had 23 teeth extracted last year with a dental
Wow.
specialist. Yeah. So there's a lot that's going on in here. I can say one thing that will really help people understand, and this is in my presentation as well. Up to 60% of dental disease is hidden below the gum line. So even if you have a tolerant dog and you have a very good veterinarian that is doing good oral exams, that's really, at least attempting to open the mouth and look back there and everything, which is that's a tall order for a lot of dogs, to do that. So even if you're getting a really good view in the mouth, you might only be seeing 40% of the problem. And there is a lot of stuff that's hidden. So until you put them under anesthesia and you go probing around, because like when we go in for our cleanings with our dentist or our hygienist, they are supposed to be probing 6 spots around every tooth and measuring how many millimeters of depth there is in that subgingival space. And you'll hear your dentist call out 1 millimeter, or your hygienist 1 to 3 millimeters. 0 to 3 millimeters is a normal sulcal depth in humans, and that is normal for dogs too. Cats, it's only up to 1 millimeter is normal. Anything deeper than 1 millimeter is a problem. Anything deeper than 3 millimeters in a dog, problem. Anything deeper than 3 millimeters in a human, problem. You can't find those problems in an awake animal. You can't be shoving probes 6 spots around all their teeth. So so what I love to get everybody to understand, and again, this is in my presentation, is to switch your understanding and your mindset of a teeth cleaning is not really if you go to somebody good who does good dentistry, especially a dental specialist, your pet is not just getting a teeth cleaning. Your pet is getting what they call a complete dental prophylaxis. Prophylaxis, like they had helping everything ahead of the game. So that means that not only are they cleaning the teeth, they're probing around every tooth in 6 spots. They're inspecting any pathology of any kind. They're x-raying. If there's any suspicious areas, they're finding pathology and they're treating it and addressing it. And if you just get a teeth cleaning, you get cleaner crowns. Hopefully you're getting cleaner gums in subgingival space, but probably not if anesthesia is not used. And you're missing anything below the gum line because probing wasn't done and x-rays weren't done.
Right. There's a lot of, there's so much on that subject that goes on. And I see a whole lot of like hygienists, I guess we can call them that, going to people's homes and doing it privately in their homes. I just want to add to it, if you are doing that, maybe in between getting, doing the real stuff, please make sure there's a vet there. Like at least have the vet, looking in that mouth and seeing, because like Dr. Kanga said, it is cosmetic, but it can't, even scraping in there in a mouth that's infected could cause some serious problems, releasing
Right.
bacteria
And
and
yeah. And a good, and I've had, a good dental hygienist for pets will tell the pet parent, hey, there's something going on in here that is above the level of what my service can do for this area or this
Yeah.
tooth or whatever, please take them to your veterinarian for a dental evaluation. So
Yeah.
that's a good hygienist that's going to call attention to a problem, just like you said, as a good groomer. Any good groomer is looking in the mouth, is tipping people off to, hey, your pet's got an ear problem, your pet's got a dental problem, your pet's got a anal problem, whatever. They're looking. And a good dental hygienist is obviously should be looking and should be informing and telling you to go to the next step when it's appropriate.
Yeah. I have a veterinarian and a hygienist that come in once a month, but we tell everybody they go home with something that says your pet needs to have this is more cosmetic than anything. And sometimes it's, I don't know. How do you feel about the better than nothing kind of thing? Like, because
Yeah,
sometimes we have people who are like, I can't afford anything else. And
right.
then
That's a really good comment, because there's value in the better than nothing, as long as people understand the limitations and they don't have the false assumption that their pet's mouth is all of a sudden super healthy, because oftentimes that's not the case. But could it be a little bit better with getting some of that? Of course. And it's not getting it off the crown of the tooth. That's not doing anything. But if the hygienist is getting up at the gum line, that's doing something. But there could be a whole lot under the gum line that's going on that is a problem and people aren't aware of it. And that's the biggest downside.
Yeah, I agree. And the x-rays need to be done. For us, when people come in, it helps us also start to do that conversation about, now, how do we prevent, right? Like, okay, let's not get back to that point, and let's try to do more prevention. So it helps. It opens up the door for talking and kind of getting.
Exactly. And if you have, and again, then you're looking in there, or whoever you have that's a hygienist, and they're telling the people, hey, this is a problem spot, please go to your vet. That's of big value. So if I was going to get that service done, I would want to be getting the service done with somebody like that.
Yeah. Yeah. Dr. Hopper is really great. She's the vet that comes in and does it. So she does it, but we're very concerned about making sure that some x-rays are done. We can't do all of that. Right. So,
and she's a veterinarian, so she's got that background and that incentive to help in that regard. So good. Yeah.
No, she's amazing.
Whereas the average hygienist, it's just way above their,
but I see a lot of people doing it, like in grooming shops. There's no vet there. There's no real anything.
And like I said, they might have had a weekend training class, and that's it.
Yeah. Yeah, so it is. Or even that, some of them are getting on the job training. They're hiring these people and like training them by somebody who was not also trained. It's crazy.
So probably a good qualifier to, go back to the great question of, is a non-anesthetic cleaning worth it? Is if you're going to have that service done, do a little interview of, what is the training level of this person, because some of them actually were a human dental hygienist. So, that can happen. So I would always trust that kind of a situation more right off the bat. See how long they've been doing it, see if they've, worked in a vet office, see, just kind of get some background and credentials and experience to at least give you a sense of the value that your pet might be getting or not getting.
Yeah. So we have a couple of people on here. Ruby's on here from Real Dog Box. Hi, Ruby.
What? Hi, Ruby.
Real Dog Box is also going to be at the Thriving Pet Expo. So all sorts of cool information that you can talk with Ruby about too. So we've got a couple of us on here talking to you guys that we're just getting. So I can't believe it's only a couple of weeks away. Like it's just crazy how much it's I want to say sneaking up on us, but it certainly didn't. It's just that all of a sudden I'm like, oh my gosh, it's right around the corner. So very excited about that. Here is a really good question that I am very interested in your answer to this. So Jessica, thank you. I love this question. Do you recommend dental cleanings during other procedures, like when a dog's getting spayed or neutered? Should we be cleaning their teeth at the same time?
Was that Jessica Coiter?
It is.
Jessica, thank you for coming. So yes, so that is a wonderful question. I do not. And there's a reason for that. So twofold is that when you are doing a dentistry procedure, there's bacteria being released and toxins being released. You're stirring all that stuff up and trying to get rid of this bacterial load. Not the opportune time to be doing another procedure, because there's bacteria and inflammation that is being shed. So you really don't want, the body to have to go through that. And they definitely wouldn't do, a sterile procedure, shouldn't be doing, a sterile procedure and a mouth procedure in the same room, by the way. Or certainly, like at the same time, because, you got bacteria aerosolizing everywhere. So you definitely don't want that. But even putting the body through that in the same event, Not ideal. And then the second reason, which is also a very important reason, and this is a really good thing to cover for everybody because this is not intuitive. It goes against what everybody would intuitively think. But everybody thinks that less numbers of anesthesia, like less times of your pet going under anesthesia is safer compared to the length of the anesthesia. So people will be like, well, I would like to get the teeth done for my pet when they're getting some other, if they're getting spayed or they're getting a lump removed or whatever, get the teeth done at the same time because then I don't have to do another anesthesia. But what anesthesiologists teach us, veterinarians, is that the biggest risk of anesthesia is the duration of time that they're under. So multiple short anesthesia procedures are actually way safer on the body than one long one. Okay. And because the longer the body is under anesthesia, the less ability that the body has to perfuse all the tissues really well, but now if it's done well, and even veterinary dentists, because some of these procedures get really long. I mean, you're extracting 23 teeth, or you're doing a jaw fracture repair or whatever's going on. Good dentists, because again, I worked with them, so I know this, they will stage procedures. If a pet has a lot going on in the mouth, they will counsel the pet parent to say, your pet needs extensive amount of work. We don't want to do it all in one go because they would be under too long. So we're going to stage it and we're going to do the most important part first. And we're going to wake them up and give them a couple of months. And then let's bring them back and do that second part. So, and here's the other reason why dentistry procedures, if they're done well, are so expensive, or any surgery is so expensive. Again, anytime you're under anesthesia, but certainly the longer the pet or person is under anesthesia, you want an IV drip, you want them on an EKG and a pulse ox monitor and all that kind of stuff. So that is adding the safety bells and whistles of, if they are under longer, you're helping to perfuse those tissues and monitoring and making sure that all the, oxygen levels and all that stuff is being met. But still, it is definitely better to keep the anesthetic procedures shorter and not to lump too many procedures at the same time if possible.
So on that note, what do you think about, the little puppies that their canines don't come out and then they're fused together, but they haven't been spayed or neutered yet? What about is that a big surgery to pull those?
That is such a good question, Carrie. And I do have, a little bit on puppy teeth too in my presentation. Super common problem. And that's called retained. It used to be called retained and now it's called persistent. Deciduous teeth, which deciduous are baby temporary teeth as opposed to permanent teeth. The adult teeth are the permanent teeth. So very common problem in small breed dogs. It can happen in large breed dogs, but it's uncommon. And veterinary dentists, the experts, will say, don't wait until their next procedure or till they're spayed, like get it out. However, I could see the tempting, and I wouldn't say it's wrong. I mean, I'm never a black and white margin person anyway. I mean, there's shades of gray, and I, hesitate to ever say anything's wrong or right. But with that, if it's solidly in there and there's 2 teeth or 4 teeth in there or something like that, I'd probably separate, because it can take a while to get those baby teeth out. Because again, if you are going to somebody who knows what they're doing, who has good dental expertise, you got to be really careful elevating those baby teeth out, because they are right smushed up against the adult tooth that you want, that's going to stay there. So right. You put a metal elevator, tool in between, and you need to pry that baby tooth out. You have to be very careful and delicate that you're not damaging the tooth next to it, because that's got to stay. So if you're damaging that root because you're trying to do it quick, or there's 4 of them or whatever, and you're already doing a spay or something like that, so you could certainly make a case for separating. And if it's just 1 tooth out of all 4 that are persistent, maybe that's fine to do with a spay. If it's already loose but it's stuck in there and it's still not coming out, maybe that's another reason. But if you have 4 teeth that are solidly in there, I might separate that from a spay. But, that's in an ideal world. Again, this is all recommendations, but, sometimes right. you got to make your decisions
Because
based
we
on all
see it
that.
so often, so many times,
Mhm.
and then it's causing all that crowding, and then the food gets
Totally.
all
And
just
you
disgusting.
exactly. And that's why you don't want to leave them there permanently. At
Right.
some point, you want to get those out. Obviously, the sooner the better. And a dentist would say, chop, chop, let's do it. Because the longer, right? Chop, chop, let's go. The longer that those teeth are in there, the more that it sets the stage for more periodontal disease. Because as you said, plaque and bacteria and food particles and everything are going to be smushed up in there and creating problems from the
Yeah.
get-go.
Yeah.
And that pet will then be prone to periodontal disease in those areas early in life.
This is, you know how I know that this topic that you picked to do is going to be amazing? Look at these questions.
I know
Look at
they're
these
so I'm like
questions.
I can't even there's like awesome stuff
Yeah,
here.
I mean, I can't, we're not going to be able to get to all of them because it's almost 6 o'clock, but I'm like, this is definitely a topic that people are needing more information about and understanding. And you know, just alone, one of the Dia's on here, and her dog's going in tomorrow for surgery, and she's like, I don't want to put him under the anesthesia that long. She didn't know, and so he's tomorrow. So she's like, I'm having,
Oh,
she says,
yeah. And it's
Mason is
yeah.
having done tomorrow before his surgery. What do I use? Oh, she wants to know what she can use afterwards. But she also said, I'm second guessing doing it. Oh my God, you just
You
changed my
say,
mind for Mason
yeah,
tomorrow. You're the best, she
it's
says.
good to be aware of that. And, you know, you can assess each situation individually and find out like how long is the other procedure, you know, what is the other procedure your dog is having? How bad, you know, if it's super simple in the mouth, then maybe that's still okay. But if the mouth is expected to be involved and the other procedure is relatively involved, then I would second think it.
Yeah. Yeah. I agree with you.
Mm-hmm.
So this is one more question that I'm gonna ask you. And I know Lauren, the person who asked this question, and so she says, Dr. Kangas, I ask this question with the most respect as possible. And I know I'm asking you to speak for the larger vet world, but what do you suggest to pet parents who are faced with holistic and homeopathic vets that are now costing hundreds and hundreds of dollars for consults? Traditional Western medicine is becoming the only affordable solution. Of course, if I knew this 6 years ago, I could have saved us $15,000 to $20,000. But now we're faced with a senior where we've tried almost everything and a bank account that now doesn't allow us to go. Oh, I lost my to allow us to go. Where did I lose it?
Quality, holistic, and or homeopathic route.
Here we go. The business
So,
of the vegetarian world is disheartening for a lot of pet parents, and I'm just wondering your thoughts and opinions. She
so
has
that
literally
is such
everything.
a good, loaded question.
Yeah.
There's a lot of levels of stuff, and it's a great question. So I love to speak to this question. Is that I have had to raise my prices to reflect my time, but I'm going to answer in the fact that I would actually disagree that Western medicine is not cheaper because Western medicine is immensely expensive. In fact, I just saw a client today, and this was actually a kitty on telehealth, where this cat is 1.5 years old, and this person has spent thousands of dollars already on ultrasounds and x-rays and testing and on and on. And this cat has digestive issues, only a year and a half. It is way cheaper to do holistic, honestly. I mean, supplements don't cost that much money. Yes, we like to do a few lab reports. What really costs is the way into holistic, is that consultation, but that's because it's time. So what I like to share with people is that I spend 60 minutes with my new clients because in order for me to be of true value to them and their pet, we need time to dig into details. We need time for me to really get a lot of questions answered, talk to them, answer their questions, and dig in to where I can really map out a recommended plan of where to go next from here, and then to, you know, fine tune that in the future. 60 minutes is with me online. I generally spend anywhere from 15 to 30 minutes reviewing records, and I spend anywhere between 30 and 60 minutes writing up my plan for them. So what appears to them like 1 hour of time with me can be 2 to 3 hours of my time. And if you go to a general practice, you are lucky if you get face-to-face time for 15 minutes with that veterinarian. So of course
Yeah.
it's cheaper because the bulk of what I make financially to support my whole staff and all the stuff is my time. because the products we sell, I mean, it's supplements, it's herbs. I mean, it doesn't cost that much. And so when you go to a regular vet, you're paying thousands of dollars for x-rays and ultrasound and, all this stuff, that surgeries that cost hundreds and thousands. I mean, hundreds is nothing. It's everything is thousands now. And so a holistic veterinarian, in order to support themselves, because we give so much time, you have to charge more or you can't stay in business, you know?
Yeah.
So I'm sorry, that is true, but it is true. I mean, the costs are rising everywhere, but it's super expensive to do anything conventionally now. And it's to the point where if people don't have pet insurance, and that's why pet insurance is starting to be a golden ticket, because there's a lot of pet parents that cannot afford quality health care in any sector, whether it's conventional or holistic, without pet insurance. So that is something to consider, before the pet has the issue, before stuff is pre-existing, et cetera, et cetera. So,
I
but
love
great question.
I love that you answered that question so gracefully, and it's
It's
really getting
expensive.
hard, but I love
So
that you
much
say that it's
time.
not holistic medicine it is not as expensive as traditional, but you're right,
Oh,
it's the getting into it. It's
right.
getting to the root of the cause, and so it's just
Yeah.
struggling. But I do know that Lauren she has tried everything. She just had a consultation with a homeopathic veterinarian, and she's just really, really struggling because
Oh,
her,
I'm so sorry.
you
And
know,
I empathize with that. And
yeah,
I totally get that, stuff is so expensive and people are expensive, but from a holistic angle, and I can at least speak from, my personal, and I know, a lot of my, people that are speaking, Dr. Katie Woodley and Odette Suter. I mean, these are good friends of mine. And it's the same thing when in a holistic context, it's a lot of time for us to really be of value, because most of the pets that come to us, you've been through all these other things with, the conventional, and they haven't worked, or they haven't gotten the pet to where, or the pet's worsened while you're doing all this. And
right,
so it really takes that time and that depth of involvement from us to really help them. And then we have to charge for it. Otherwise we can't do
right,
it.
yeah,
Yeah. But
no,
I
it's.
get it. I get
I
it.
think Lauren gets it too. She's just like, is there something else I can do? I don't know what to do.
Yeah.
So and
I
you
mean,
do
and
this
yeah,
great job.
the best thing, and I just had an awesome compliment from somebody yesterday. I'm going to share this, is because I was like, plug into as many resources as you can, but sometimes you still can't get the customized support you need. And I had
Right.
a wonderful comment from somebody who, because I was on Inside Scoop with Rodney Habib and Karen Becker, last month, Dr. Becker, and I've had a lot of influx of, telemedicine, wonderfully from that. And I had a person tell me that she's enrolled in, courses and watches all these podcasts. She's like, I've amassed so much information. I'm a religious inside scooper, and I watch so much stuff. And she's got so much knowledge. And she goes, but I need somebody to tell me how to apply this to this situation in my pet, and I don't know what to do. So she's like, I'm so glad I found you. I just need somebody to help me with my pet with a plan. And
Yeah.
so, amass as much education and information, and sometimes you can achieve so much just with that. I mean, it's so helpful to plug into those resources.
Yeah.
But in some circumstances, finding somebody that can really help you with specifics is golden. Yeah.
She's probably going to be at the Thriving Pet Expo, which is another, that's the other thing about coming together like this, because you can start to share stories and start to kind of maybe just piece it all together. It's harder to do when you're not face to face with somebody, to
Yeah.
really understand the context and how it works and how it doesn't work. And so it's one of the reasons why this is our second year of doing it, because
Yeah.
yes, we all have access on the internet, but just like your friend, she's doing everything, but she needs to have that interaction in order to actually apply it. And so
Yep.
that's what we're going to be teaching a lot at the Thriving Pet Expo, is how to apply it. I can't wait for you guys to see what we have in store. I mean, I just can't. It's some of the stuff we're doing. I was telling a good friend of mine, I feel like I'm really nervous because I'm taking some risks. But she reminded me, because we both were on the speech team in college, with great risks come great reward. And then I, of course, get negative, and I said, and great failure. And she says,
Well,
stop it.
we always learn from those too.
We do, we do,
So
we do.
either way,
But
ultimately it's a win.
I'm just so glad that this group of people all is willing to come together with me and try something different that I don't think any
Yeah.
expo has ever done before.
Yeah.
So I'm really excited about teaching pet parents how to communicate with their veterinarians and what to say. And so when
Yeah.
they listen to Dr. Kangas speak, and then, okay, now what do I do? I understand it, but how do I apply it? How do I go
Yeah.
into my conventional veterinarian and
And
how
I,
am I going to apply that?
yeah.
And so, yeah, it's going
And
to
I
be a lot
love
of
that you say that too, because one of my big things too is just equipping people with action steps too.
yeah,
It's
yeah,
nice to have knowledge, but if you don't know how to apply that, it's limited.
it's limited.
So that is one of the reasons why I take such time to create these notes for my clients when they see me for a session, is so that they literally have an action step plan. But
Yeah,
even when I speak and present, I mean, I'm all about giving empowering pet parents as much as possible to apply that information and use it, and not just have lofty information that doesn't get you anywhere.
yeah.
So
So I know that it isn't cheap to go to the expo as well. I get that, but I will tell you guys that it is by far the best money you can ever spend. The food is going to be amazing. The speakers we have so many speakers, so you're getting a huge value out of it. But I do know that we do have 1-day tickets available. So we did help that way to get you guys there for 1 day. So just for today, or well, what we're talking about right now, Dr. King, is what day are you speaking and what time are you speaking?
I am. Oh, that's funny. I
Oh,
should know,
we should
right?
have done that
I
too.
I believe I'm Sunday, and I believe I'm first.
Yeah.
So
Yeah.
my 8
So
a.m. or whatever
yeah.
whenever we
So
start.
Dr. Kingus is speaking Sunday, first speaker. So if you can only do a 1 day ticket, make sure if you want to listen to a talk on dental and you go to the website and you look up. So Dr. Kingus will be speaking first thing Sunday morning. So if you want to listen to Dr. Kingus, make sure you're there Sunday morning. So, but we did do that to allow some affordability for people to be able to come in. And remember, it includes your lunch. And so, you're saving money there wherever you would have eaten lunch that day, unless you were going to eat at home. So there's going to be a lot going on, a lot of information, and just not just the speakers, but the vendors. And there's so many pet people that are going to be. There's going to be vets in the audience. We have a lot of veterinarians that are coming. I'm very excited about. I just found out today how many vets are going to be there. So I'm really excited about that. So it's just going to be amazing. But Dr. Kangas, what are you the most excited about? And then I'm going to let you go because it's 6:06.
Oh, thank you. Well, I'm excited to just give people information that I know is so useful for them. I feel very rewarded knowing that I get to impact a lot of pets and a lot of humans. That's why I love what I do so much, because not only do I assist pets to get to better health, but that totally impacts their humans to be happier, and ultimately often affects their health too. So, just the more people that I get to reach and the more pets that I get to reach, I just get jazzed up about that. And I get jazzed up about seeing you and everybody else that's going to be there, because it is fun. It is fun. And you feel empowered and energized and lifted
Yeah.
after an event like this. And everybody felt it last year. And that's, of course, why you wanted to do it again. So
I know. I'm like, we were so energized after last year. I was like, let's do one. Lori is behind the scenes right now, but we were like coming off such a high last year that I was like, okay, we'll do one in every city. And we just had to,
because it feels so awesome.
it just felt so, I was like a drug. It was like this
Yeah.
amazing drug and this amazing feeling.
Yep.
And it lasted for such a long time. And it's just, I can't wait till this year. I'm so excited. So, and I'm
Yeah.
so glad that we've got you up there speaking this
Thank
time. So
you.
it's going to be great. Yeah. And the
Thank you.
Q&As, we've left a lot of time for Q&As. So it's really amazing. So,
That'll be
all
great.
right,
'Cause
guys, we
that
got
could
to
be
let
fun.
Dr. Kangas go. But thank you everyone for being here. What wonderful
you.
questions. If anything, that was so inspiring to know that the topics that we picked this year have been on point for what people are looking for. Because we have Billy Hookman next week, so he's going to announce his topic. But so far, the questions that are coming out are just evident that these topics are what we need to talk about. So we're super excited.
Perfect.
Yeah. So behind the scenes is Lori. She's also the one that is, without her, the Thriving Pet Expo wouldn't even exist, because she's on fire as far as putting these together and organizing them and getting it all together. So, Lori, thank you so much.
Thank you, Lori.
Yeah. And I will see you guys next week. Dr. Kangas, I'm going to see you in a couple of
In a
weeks.
couple of weeks. Thank you. Looking forward to it.
I know. All right. For those of you guys, if you're still having, oh, I'm so sorry. I messed up. Billy's on the 28th. So
Oh,
he's
okay.
not next week. He's on the
Good.
28th. So he's going to announce his topic on the 28th. Lori just let me know.
Woo, right before the
It is. It is right
right
before.
before
He's a
the
busy
event.
guy. You and Billy are busy, busy
He's
people.
gonna be the cliffhanger for everybody. It's awesome.
I know. I know. Oh, just waiting to hear what Billy's
Yeah.
topic is, you know. So,
Yeah.
but ticket sales are going quite rapidly. So, if you guys are on the fence, I would tell you don't wait much longer because there is limited seating, and they are starting to pick up quite rapidly. So, please don't wait much longer. Last year we sold out, and I had to tell people no. It was awful feeling because there was people that just waited to the last second. Don't let that happen to you. Also, if there is something that is blocking you, no matter how big or scary or whatever it is that's blocking you from getting here, please send me a private email. You'd be surprised at what magic can happen if you just ask. So just send it to me through email, and you never know what might happen. So don't let something block you from getting to the most important event of the year. In my opinion, you're going to be getting so much value out of it. Okay. All right. I will see you guys soon. Thank you, Dr. Kangas. See you soon. Lori, everybody, good night.
Thank you. Have a great night, everyone. Bye-bye.